And we're going to kick off today with our health care debate. Yet again, it continues to dominate all. We're joined by Congressman Tom Price, Republican of Georgia, head of the Republican Study Committee, and a doctor. So thank you very much, Congressman Price, for being here.
Thanks. Great to be with you.
I want to just get a sense. Are you guys now at a place where you're happy to sort of sit back and let the Democrats fight this out amongst themselves, that the Republicans don't really need to do much more here, that now it's all going to be the Democrats that are going to hammer out this health care bill?
What we've been encouraging all along is the politicians here in Washington to listen to the American people. And I think that's what you're seeing. What we see on the moderate Democrats and certainly on our side is that we believe that the American people aren't behind the bill that's before us in the House of Representatives, a bill that would in essence be a government takeover of our health care system. And that's why you're seeing this slowdown on the House side.
In terms of Republicans offering ideas on this, I want to read back to you something that Congressman Roy Blunt, who's been heading up the health care reform efforts in the House from about a month ago, June 17th, he said, quote, "I guarantee you we will provide you with a bill." Is that still the thinking that there will be a bill from Republicans, and when can we see it?
Well, in fact, the Republicans are the party of ideas, and we've got all sorts of bills out there. The Republican Study Committee, the group I chair, will be offering a bill this Thursday that includes a patient-centered system that makes it so that patients and their families, along with doctors, are able to make medical decisions, health care decisions, instead of having a bureaucrat, government bureaucrat, inserted into the middle of that, which in fact is the proposal that's on the table in the House right now.
Congressman, will that bill provide for universal health care for all Americans?
What it'll do is make it so that it's financially feasible, attractive, and foolish for anybody not to be insured through the tax code, so that we make it so that individual patients and their families own and control their health care policy, so that they're the ones that are in charge, not the insurance company, not the government.
Congressman, you wrote an op-ed this morning in the Atlanta Journal-Constitution laying out the Republican case in large part. And one line in there I wanted to ask you about. You said that 119 million people would be crowded out of their health plans. Now, we went back and looked at the facts surrounding that, and even the authors of that study say that's not really accurate. That's under a Medicare for All policy that isn't being debated. Why continue to use a statistic like that?
Well, in fact, it is continuing to be debated. That's essentially the bill that was turned out of the Senate Health Committee. And so it's important to put the facts on the table. Even the Congressional Budget Office says that if there's a government-run program, that there will be millions, tens of millions of individuals crowded out and forced to move from their private personal insurance to the government-run program. We've seen it in Medicare. We've seen it in the S-CHIP program, moving individuals from their private personal insurance to the government-run program. So the fact of the matter is that it's not whether it's going to happen, it's how many people will it happen to.
How do you get competition, real competition, and sort of keep the insurance companies in line? It's not that healthcare would be run by the government. Sure. Nobody's discussing that. It's simply the idea of having an option out there for one option that people could choose is a government-run plan, and the president says that would keep insurance companies in line. How do you do that without the government getting involved?
Well, it's a great point, but the bill itself that's before the House of Representatives would in fact have the government running everything within a period of 5 years, because they would define what qualifies as a health policy, as a health insurance program. The way that we do that is to empower the folks that ought to be empowered in this system. And that's not the government or the insurance company, but patients and their families. And the way that you do that is to make it so that every single patient and family own and control their health insurance policy. That way the relationship between the insurance company and the individual becomes so much different, because patients then have power, have control in the system.
You mentioned a moment earlier, Congressman, about conservative Democrats who have had significant problems with this bill. Do you anticipate being able to get them on board for your proposal and make that a bipartisan proposal?
Well, so many of the things that they're talking about are the kinds of things that we've been talking about since the beginning of this debate. Now, whether they'll come all the way over to our side and believe that the proposal that we have put in place, that patient-centered proposal, whether they'll be able to support that, I don't know. There's a dynamic going on the other side of the aisle right now. But what I do know is that if we slow this process down so that the American people can gain an appreciation for the alternatives that are out there and the proposals that have been put on the table, then that's the kind of support that the American people will need for a proposal that will ultimately come forward.
What's the price tag on your bill?
Ours is budget neutral. We have some remarkable savings through the system because we actually address the issue of defensive medicine, actually address the issue.
But aside from
of
it
the
being budget
liability
neutral,
control.
what is the price tag? I understand you may get enough revenue to pay for it, but what is the cost?
Actually, CDO hasn't scored ours yet. We estimate it to be in the range of $600 to $700 billion. We also estimate that we will have that money within the bill itself to be able to pay for it.
Congressman Tom Price, Republican of Georgia, thank you so much for being here today. We appreciate it.
Thank you, Dave. We
Thanks.
appreciate it.